Good morning. Today I have Donna Pinciotti in the clinic, and we're going to be going over some recommendations that she could implement at home to help improve her oral health. So Donna is going to be seated in an upright position in the patient op chair. I'm going to start off with her PCR score. So Donna, your PCR score was 30%. There was a lot of plaque biofilm accumulation that were in between your teeth. And I will be giving you some tools that you could use that are going to help you reduce the amount of plaque biofilm accumulation in between your teeth. So let's talk about plaque biofilm. So plaque biofilm is that sticky, colorless layer that adheres to the surfaces of your teeth, your gums, and your tongue. Biofilm can irritate your gums, causing an inflammatory response. So it makes your gums more red and inflamed instead of that healthy pink firm state. So this is what it looks like when you have that inflammatory response on your gums. If the plaque biofilm is left and it's not removed, what could happen is you can get a gum disease. So that would be the early stages of gum disease, so that is gingivitis. But with gingivitis, if you maintain a good oral hygiene routine, it is reversible. And a more severe stage of gum disease is periodontitis, and that's where it affects the bone. And that is not reversible. As soon as that bone loss is gone, you're not able to get it back. However, you are able to stop the progression of periodontitis with the recommendations that I am going to be giving you. Now, I categorized you as having generalized moderate periodontal disease. So what that means is generalized, meaning that it is throughout your mouth. With the x-rays that you provided us with, we were able to see that there was bone loss, especially in your back teeth. And moderate meaning that the bone loss wasn't to the point where it was severe. However, it's moderate enough to where we do have to get that under control. So the recommendations that I am going to give you. So, an electric toothbrush is always a great option to use. Those have, you're moving the toothbrush along your teeth, so it'll basically do all the work for you. Now, if you don't want to purchase an electric toothbrush, or you just want to stick to a manual toothbrush, I am going to recommend the modified Bass technique. So what that is you're going to hold your toothbrush at a 45-degree angle to the gum line, and you're going to use circular motions, and you're going to brush down away from the gum line. So you're going to start at the gum line at that 45-degree angle and then brush down to the top surfaces of your teeth. With the inside of your teeth, you'll start again at that 45-degree angle, using those circular motions, and then brushing up away from your gum line. With your front teeth, you're going to start at an angle again, but you're going to be going from your gum line and just sweeping up to the top surface of your teeth. So at this time, I would have my patient demonstrate how to use the modified Bass technique, and then I would hand Donna a clean toothbrush, and she would demonstrate in her mouth while I am holding the mirror. I would want her to show me 3 different areas, and I would help make any corrections if needed. Now, I will recommend flossing. That's really going to help remove that plaque biofilm that are in the spaces between your teeth. So string floss is a really good way to remove that plaque biofilm. So what you will do is you're going to grab an arm's length of floss, you're going to wrap it around your middle finger, and you want to leave 1 to 2 inches of the floss so you're able to place it in between your teeth. So what you will do is, using a seesaw motion, you're going to seesaw your way into your in between your teeth. You're going to wrap the floss around your tooth, and you're going to form that C shape. That's why it's called that C shape. And then you're going to use up and down motions. Then you'll wrap it around the other tooth using those up and down motions. It's very important to remember to move the strand of floss along. You want to use a clean piece of floss on each tooth. Otherwise, if you continue using the same one, all you're doing is moving it around in your mouth. Moving it around in your mouth instead of removing the plaque biofilm. At this time, I would hand my patient a clean piece of floss. They would demonstrate on the mouth model, and after they feel comfortable with the motion, I would have them pull a arm's length piece of straw from the floss container, and they would demonstrate in their mouth, and I would correct them if they need any corrections. I'm also going to recommend that you use an interdental brush. This is good for those larger spaces that you have in between your teeth that the string floss isn't able to get to. And I will recommend a tongue scraper. So the tongue scraper is a good tool to use to remove the plaque biofilm on your tongue. So what you'll do is this little rough edge, you're going to place it on your tongue as far as you can go back without causing any gagging. And what you'll do is, in one smooth, slow, fluid motion, you're just going to pull the tongue scraper from the back of your mouth to the front of your tongue. And if you feel that you need to do it again, just go ahead and rinse it off with lukewarm water and then repeat the process. I am going to recommend that you do this in the morning after you're done brushing your teeth. With the flossing, start off with doing it 1 time a day, preferably in the evening. And once you get into the habit of flossing in the evening, you can start incorporating that in the morning. I am going to recommend a fluoride toothpaste. This is going to help your teeth against cavities that I will discuss in just a moment, as well as a fluoride mouth rinse that has no alcohol in it. This is a total care, so it does provide more than just more benefit than protecting you against cavities. It could also help with sensitivity, which we do have that option over here. Now, with the medications that you are currently taking, you did mention that you do have dry mouth at times. So dry mouth is a very common side effect for any prescription and non-prescription drugs. Having dry mouth will increase your chances of developing cavities. Your saliva has many functions. You know, it has functions as far as forming a protective layer around your tooth enamel, which is that outer, harder layer. Saliva can replenish the minerals in your saliva, such as calcium and phosphorus. And then saliva is also necessary for antibacterial activity that protects your teeth as well. So I do have these xylem mints that you could just put right in the inside of your cheek while you are sleeping. This is going to help stimulate your saliva while you sleep. Your saliva isn't as active as it is when you're up during the day. Now, there are other options. There is a biotin rinse and a gel. The rinse you would use in the evening before you go to bed, and then the gel you would just rub a small amount on the inside of your cheek. With your diet, now I see that you do like to snack on crunchy, sticky foods. You did mention that you do have somewhat of a sweet habit that you're trying to get under control. So you want to limit just the amount of cariogenic snacks that you are eating. The pretzels and the protein bars that you mentioned that you just grab on the go. You want to incorporate foods that are going to limit the amount of like stickiness or crunchiness that rests on your teeth. So you want to have yogurt, with some fruits. Apples is a great option. String cheese. Some veggie sticks are some good options that you could, grab and go. And let's talk about cavities. So I do have a little animation here explaining the process of tooth decay formation. So cavities is one of the most common oral forms of disease. This is the process of cavities. The process of cavities is tooth decay. So the tooth decay is the destruction of that outer layer on your tooth. When you eat or drink any beverages containing sugars, the bacteria in the plaque produce an acid, which is showing you right here. Here's the bacteria. And that acid attacks your tooth enamel. And the stickiness of the plaque keeps those acids in contact with your teeth. And over time, the enamel will start to break down, causing what looks like a hole on your tooth. So you could develop those on the top surfaces of your teeth, in between your teeth, and then also at the bottom of your teeth. You do have restorations from previous cavities. So to limit the amount of sugary foods or sticky, crunchy foods will definitely help improve your overall health. Now, you want to make sure that you do implement these recommendations that I am giving you, because if you continue to let your periodontitis progress, it can eventually lead to losing your teeth because the bone isn't there to support your tooth and then also help keep it in place. Now let's talk about your diabetes. Now this is very important, and that you also keep in mind whenever you're starting your oral hygiene routine. So having diabetes, it does increase your chances of developing gum disease. Periodontal disease can lead to pain, it can lead to bad breath, difficulties chewing, and as I mentioned, tooth loss. Diabetes slows down your healing process, which can interfere with dental treatment. And maintaining a good blood glucose level is key to controlling and preventing any oral issues. Poor glucose control can affect how your body fights off any harmful pathogens in your mouth. Now, the category that I have you down for your caries risk assessment, I did put as high because of the recession that you currently have, because of your diabetes, your previous restorations that you currently have, your snacking, the medications, and then also the plaque biofilm accumulation, as well as tartar. So tartar is that mineralized, crusty, hard deposit that forms on your tooth. It looks yellow, sometimes brown. And tartar is formed when the plaque on the surface of your tooth interacts with the minerals in your saliva. So as you age, you become more prone to developing tartar on your teeth. And at this time, I would ask my patient if they have any questions, and if they don't, I would like to thank them for their time.